So, I graduated fellowship today. Wow. Man, I'm at loss for words. I just finished my last surgery of fellowship. Went great. I was walking up here to let you guys know the great news, and I had to just take a second to just take it all in. I've worked so hard to get to this point, starting in 2001 when I started at a community college in San Antonio, Texas, taking pre-med courses. And I was active duty in the Air Force, working full-time, and then going to school full-time. And 19 years later, when I first stepped into a classroom in 2001, 19 years later, this is where I'm at. So I always tell people the 14-year path that it takes to get to this point. 4 years of college, 4 years of medical school, 5 years of surgical residency, 1 year of fellowship. Well, my path was actually a little longer than that, way longer than that, but I just don't tell people that. It took me 19 years to actually get to this point, because it took me 7 years to graduate from college just because I was in the active duty Air Force, having to drop classes because of my military obligations. Went to Iraq in 2005. I didn't get into medical school my first 3 years of applying. I had to do a 1 year post-bac. So that's an additional, 4 or 5 years right there. So crazy. I just can't wrap my head around it yet. It hasn't hit me yet. You do all of these years of schooling, late nights, cramming for tests, missing out on important events, life events, family, social things that you're missing out. You're losing friends along the way. All for this right here. My certificate I received today. Texas Back Institute, Plano, Texas. Spine surgery, August 1st, 2019, July 31st, 2020. Crazy. This is a product of years of grind, of sacrifice, of hard work. And I am so thankful to be in this position that I can't fathom what to say at this point. I got a couple other gifts from my program here. They gave us a little package. One of them was this book here, Minimally Invasive Spine Surgery, by one of my mentors, Isidore Lieberman. He's a spine surgeon here, one of my mentors. So they say that your learning just begins when you finish all your training. People think that you go through all this school, you go through all this training, and then the learning stops after that point. It actually just begins. Just like in medical school, you don't really learn how to be a doctor until residency. Well, you really don't learn how to be a surgeon until you're out in practice. You're figuring things out on your own. So, the learning just actually begins. We got a couple other gifts. Let's see if someone can say what this instrument right here is. Put it in the comments below. What do you think this instrument is? So, tradition for most programs is to give their graduating residents, fellows, certain gifts. So as a resident, we got some cowboy boots because we're in Texas and that's a Texas thing. And the cowboy boots had our name on it and our program emblem. We also got an office chair, and this is a tradition that once you graduate your residency, you'll get a chair for your office. It's a tradition. It has your program name and also your name on the chair. Well, this is a tradition of my fellowship program. These are carrettes. These are instruments that we use in surgery, and they got my name engraved on them. So I'm not sure if you guys will be able to see that because the engraved part is really small, but I'll hold it there for a second. But this is a set of instruments that I will use in surgery. Obviously, these need to be sterilized before they're used, but this is an instrument that we use when there's, say, for instance, bone. Actually, I have a model here, and I'm trying to decompress a nerve that's right here. Well, this bone here may have some tissue under that bone, so I'll slide this little carrette under there just to clear it out You can also use it to clear, soft tissue off of the bone before we put in our pedicle screw. So great instrument, great tradition. Man, this is awesome. The last little gift that I got, this is a retractor that we use in spine surgery, specifically cervical spine surgery. Whenever there's a collapsed disc in the neck, this is an instrument, actually open this, that we use to distract. See? I love the way that sounds too. So basically, this, we're doing an ACDF, anterior cervical discectomy and fusion. This goes between those two bones to distract them to clear out the disc space there. So this was another gift that I received. I'll put that back on there. And I'll get this sterilized also to use in surgery. I don't think this one has my name on it, but for all those pre-med students out there, even if you're not going, into medicine, you're going to law school, business school, pharmacy school, hopefully you can find some inspiration from my path. It took a lot to get to this point, but, there was nothing that was going to stop it and stand and get in my way of reaching my goal to become a spine surgeon. And today kind of concludes that. All the years of hard work, late nights, studying anatomy with a cadaver by myself in the middle of the night, losing friends along the way. This is where it came down to. This is where it came down to. So, students out there, keep working hard. Never, 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 never give up. I always tell people that if it would have took me 10 years to get into medical school, I would have applied every single year until I got in. And if you want something, that bad, you'll eventually get it. You just have to tweak a little bit here, tweak a little bit there, do this, do something extra to your application. There's ways to reach your goals, and that's kind of the definition. And I consider myself the definition of grit, which is having that perseverance and dedication and determination, no matter what the circumstance. So look at me, use me as an inspiration. If I can do this, go through everything that I went through in my life, and you guys kind of know my story growing up in Louisiana, having family members in prison. My mom was shot and paralyzed. She's paralyzed from her waist down. My little sister went to prison. My dad did drugs and sold drugs, joined a gang, went to prison as well when he was young. So if I can go through all that, get rejected from medical school 3 times, took me 7 years to get my bachelor's degree, get into a residency program, my number one choice, become a spine surgeon, July 31st, 2020. Thank you guys for following my journey. I hope to bring more inspiration to you guys and show you what's it like to be attending spine surgeon. What's it like in my next chapter of my life. So you guys are going to have to wait. I'll let you guys know what I will be doing next. Will I be going to academics? Will I be going to private practice? Will I be practicing in Missouri or Idaho or Michigan? I'm going to let you guys know in my next video. Thank you guys for watching this video. Make sure you subscribe. New videos coming every week. We'll see you next time. Well.